Welcome back to Daybreak. According to the Pew Research Center, 69% of adults and 81% of teens in the U.S. use social media. Now, this puts a large amount of the population at an increased risk of feeling anxious, depressed, or ill over their social media use. And joining us now is Baptist Health psychiatrist Dr. Christina Kennedy to explain how social media is impacting us. Good morning.
Good morning.
I mean, it's kind of obvious. This is such a huge thing that a lot of people are talking about. But I want to know what you think social media can do to someone's mental health.
Yeah, so repeatedly it has been shown that higher use of social media correlates with increased risks of anxiety and depression. And we see that particularly amongst adolescents and young adults. And I think a big reason that we think that happens is, decreased social interaction in person, and often that social comparison that tends to happen between, the people that are using social media and, just this glorified version of people, what they put out on social media.
Yeah, because of course people are posting the best things happening in their life. And then with the rise of influencers, you're seeing their perfect life. And then I always think about the beauty standards as well. Now, are there also positive ways that social media can, help your mental health?
Yes, so social media at the end of the day is a tool, and particularly for communication. And so it can definitely facilitate communication between people that are far apart, and sometimes be used as a community social support. I have patients that have maybe a rare medical disease that are able to communicate with people across the country and the world that have the same type of thing going on. And then there's also an increased availability of medical and mental health resources available through social media platforms.
And lastly, I do want to ask you about that there's been a rise in mental health content. Do you think that this has a positive impact?
It has a positive and a negative impact. So we do see that stigma of mental health and mental health treatment has decreased, but a lot of the information that's online, well, some of it's just wrong, but a lot of it's just limited and generalized, and that can often lead to people self-diagnosing or, thinking just normal things or symptoms mean that they have a disorder. Just like if you typed in a headache on WebMD, and you think you have a brain cancer, the same thing can happen with mental health, where a symptom doesn't necessarily mean a disorder.
Okay, so maybe it will alert something for you, but obviously you need to talk to your doctor about anything.
Exactly.
Well, thank you so much, Dr. Kennedy, for joining us. Of course, if you want to get in touch with Baptist Health, you can go to their website or just give them a call. That information is right there on your screen.